Hello everyone, my name is Leah Westfall and I will be presenting on my thesis on the complex relation between maternal depression and child internalizing behaviors. So I began with the concept of intergenerational depression, and this is the idea that children of parents with depression are more likely to develop depressive symptoms themselves compared to other children. And in this way, depression can be transmitted through generations. So for example, if your grandmother suffered from depression, her children are more likely to develop depression themselves. So perhaps your mother was also depressed, and now you yourself are more likely to develop it, and so on through the generations. Further in the field, there is some debate over how it's best to measure childhood depression. So in young children, we often look at internalizing instead. And these are negative behaviors that are focused inward, including social withdrawal and fearfulness. And these are frequently used as a predictor of future psychopathology, especially anxiety and depression. So we know what intergenerational depression is, but how likely is it to occur? So some background, depression affects approximately 7.1% of all US adults. But we also know that new and young mothers might be especially vulnerable because both females and younger adults, age 18 to 25, experience depression at elevated rates. And just to really drive this point home, two 2011 studies found that 1 in 10, or at least 15 million children, live with and experience a mother with depression in any given year. So to further examine this concept, we know that it's not something that's predetermined. So if your parent has depression, you are not destined to develop it yourself. So I wanted to look at what are some of the potential factors influencing this transmission. And there are a ton, some of which include family stress, single mother versus two-parent households and other family structures, child characteristics, parenting style and behavior, and parent-child relationship quality. And to keep things narrow, my study chose to focus on the last two, while also attempting to control for some of the first three bullets using demographic questions. So for maternal depression and parenting behavior, it's been studied that it's been shown that depressed mothers are more likely to engage in certain maladaptive parenting behaviors, such as harshness, disengagement with children, and inappropriate levels of control. So this could be either over or under control. And these behaviors might lead to the development of child internalizing behaviors. And furthermore, many studies choose to focus on parenting styles, such as authoritarian, authoritative, permissive, but I wanted to look at more specific behaviors in my study, falling into categories of laxness, overreactivity, and verbosity. Moving on to mother-child relationship quality, it's been found that higher levels of maternal depression are linked to lower maternal sensitivity, and this can be problematic because maternal sensitivity helps to foster good relationships with children. And these researchers found that this relation was strongest where infants displayed negative interactions with their mothers. But this also suggests the potential for positive protective effects. So positive interactions between mother and child might protect against harmful outcomes. So to put all the pieces together into my proposed model, I examined three hypotheses. The first was that high levels of maternal depression will be significantly related to high amounts of child internalizing. So that would be illustrated by a direct effect from maternal depression to child internalizing. Second, this effect might be mediated by maladaptive parenting behaviors, something like this. And third, the relation between maternal depression and parenting behaviors might further be moderated by mother-child relationship quality, such that for mothers with more negative relationships with their children might engage in higher levels of maladaptive parenting, whereas more positive relationships might have a sort of protective factor and result in less frequent maladaptive parenting behaviors. For my methods, I had a sample of 50 mothers with children aged 4 to 6. These were primarily white children with college-educated mothers. All participants completed an online Qualtrics survey. We asked questions in the categories demographics, so these were used largely to determine any potential covariates. Maternal depression was measured using the Center for Epidemiological Studies depression scale, and this scale cannot be used to clinically diagnose depression, but rather it shows relative levels of depressive symptoms in a given sample. Parenting behavior was measured using the parenting scale, and this scale presents parents with typical scenarios such as when my child misbehaves, I blank, and then the parent has to select from 7 options that range from effective to ineffective. And this scale can be looked at the aggregate level, so overall levels of ineffective parenting, or broken down into subscales such as laxness and overreactivity. Mother-child relationship quality was measured using the child-parent relationship scale short form, and this scale again has 2 subscales, one for conflict and one for closeness. Conflict was used to represent negative relationship quality and closeness for positive relationship quality. And finally, child internalizing was measured using the strengths and difficulties questionnaire. For the analyses, the preliminary analysis were used to identify any potential covariates. So to do this, we looked at demographic variables and saw if they were significantly correlated with any of the outcome variables. And actually only a few did show significant correlations here, and when we incorporated them into the models, there was no difference in the pattern of effects, so for the final analyses, no covariates were used. For the primary analysis, we looked at 3 main models. These were negative relationship quality and overall ineffective parenting behaviors, positive relationship quality and overly lax parenting behaviors, and positive relationship quality and overreactive parenting. And the reason that for negative relationship quality, we didn't break down parenting into the different subscales is because there was, again, a significant pattern of effects across the subscales, so we combined them into one model. So what we found for model 1 was that overall, the predicted direct effect from maternal depression to child internalizing was there, and this was actually found in all 3 models. Furthermore, negative relationship quality was directly related to overall ineffective parenting, as it predicted. And finally, we did not see the predicted mediation from maternal depression to ineffective parenting to child internalizing, and unfortunately, this result was also consistent across all 3 models. Moving on to model 2. Again, we see the direct relationship, maternal depression to child internalizing, and this time we saw an inverse relationship between positive relationship quality and overly lax parenting behaviors. So this suggests that for relationships high in closeness, there was a sort of protective factor and less maladaptive parenting occurred. Additionally, there was actually a marginally significant direct effect from overly lax parenting to child internalizing, but again, the overall mediation model was not supported. Finally, model 3 had a little bit more going on. So again, we see the direct effect, maternal depression to child internalizing, as well as the lack of mediation. But what we do see over on the left in red is a negative association between maternal depression and overactive parenting. And while this might seem counterintuitive at first, so parents higher in depression seem to be experiencing less maladaptive parenting, this could be because mothers with depression might be less confrontational with their children. Additionally, we see again an inverse effect from positive relationship quality to overreactive parenting, again showing this sort of protective quality. But interestingly, there was also an interaction between positive relationship quality and maternal depression, such that for mothers high in closeness, there was a direct relation between maternal depression and overreactive parenting. And this might be because mothers with depression who might otherwise be non-confrontational, but who have a close relationship with their children, might more readily interact and thus overreact with their children. So to sort of synthesize all of these results, put it all together, overall, the results supported the concept of intergenerational transmission of depression, and that could be seen through the direct path from maternal depression to child internalizing seen in all 3 models. And although my other specific hypotheses were not supported, the results did serve to further illuminate ways in which these study variables interact, such as the positive relationship quality by maternal depression seen on the previous slide. So while parenting behavior did not emerge as a mediator, this might have been due to homogeneity of the sample, So these were primarily white, well-educated, married women. Also be due to bidirectionality. So it's been shown that child characteristics such as temperament can also influence both maternal depression and child outcomes. And finally, it could have just been due to other unaccounted factors. So I mentioned there were a lot of different potential influences on the transmission. And these also include things like genetics, relationships with fathers, and mother-specific depressive symptoms. So looking ahead, future studies might choose to sample a more at-risk population, such as mothers previously diagnosed with depression. Additionally, studies could expand the scope and include even more variables to see what other interactions exist. Or the converse of that, future studies could further probe the different pieces of the overall models, such as the interaction term that we saw, or the direct effects of parenting behaviors on child internalizing. Because as we saw, my model attempted to put all of these pieces together, but it was difficult to predict what specific interactions would happen without a more in-depth understanding of all the individual pieces. Finally, I would just like to thank my thesis group and my wonderful advisor, Professor Augustine, for all of their help and support along the way. Thank you.